So, hi guys, this is me, Lyan C, and for this video is that we are going to talk about the male genitalia of our patient, also some prostate also. And then for this video is that we are not going to assess male, nga mag-assess ta sa iyang male genitalia, but I'm just gonna state the procedure and the normal findings on how this assessment going on. So for this assessment is that we are going first to determine the equipments first, that we are going to use some stool, the gown, so for the privacy of our patient, and then the disposable gloves, and then the flashlight, and then stethoscope because it is needed, and then also stethoscope with a possible auscultation that is needed. So next is that we are going now to assess the penis of our male genitalia. So by assessing this is that we are going to inspect and palpate the base and pubic hair. So that is why we are gonna note the pubic hair, the growth pattern probably, and then any excoriation of our base and pubic hair of our patient, and then if there are lesions, infestations, and then at the base of the penis, like within the pubic hair. So that's it. So for determining the normal finding is that we are going to assess that kung free ba ang yang excoriation and infestation, and then pubic hair also has a growth pattern. Okay, naman siya pattern good sa pagtubo sa kanang hair sa ato ang ubos sa mga laki na. So inana po sa babae na po na siya pattern sad. So and then also if it is normal for the adult male. So alright, so we are done inspection and palpation na siya. Next is that inspection and palpation gihapon siya, but ang shaft ang ato abuhaton. So for the shaft is that we are going to note the skin for rashes, and then lesions for lumps, and then to note the hardened ba siya or tender areas. So to define the normal finding is that free of rashes ba siya, and then na ba siya lesions, lumps, and then some soft ba siya, and then also flaccid, and then non-tender on palpation. So, muna siya sa inspection and palpation of the shaft. Next is we are going to inspect gihapon and palpate the foreskin and glands of our patient. So, this is where to note if the size and shape. So, manini siya ang size o gang shape o gang sa inspection and palpation. And then also, if na ba siya lesions gihapon, redness ba siya ang iyang glands, not the glands but glands. And then also if to note the color, the location, the integrity, and then the retraction of foreskin. So, to determine the normal finding is that we are going to determine this, that circumcised siya, and then also ang glands niya is rounded and free of lesions. Alright. So, after that, still inspecting and palpating the urethral opening na siya. Urethral opening of our male genitalia of our patient. So, and also the discharge. To determine this is we are going to note the location of the urinary, di ba? Kung asa mo gawas ang ihi sa laki. And then to discharge the present, also the color, the consistency, and the character and odor. And then also we are going to determine now the normal finding if it is meatus ba siya, centrally located on glands, and then also discharges noted. Ang urethral opening and discharge. So next is that we are now going to assess the scrotum of our patient, which is under in the assessment of the male of genitalia. So for this scrotum is that we, by inspecting the scrotum, we are going to note the size and shape and the position. So, diri makita ang note nga, swelling ba siya, lumps, or bulges. So, man siya. So, to define the normal finding is that ang size niya is that kanang no swelling or masses that are noted, size, shape, and position niya, normal finding. And then also left side, nakahang siya left side ang iyang scrotum, and then hangs slightly lower than the right side. Next is that we are now going to inspect the scrotal skin of our patient, that we are going to determine the color, the integrity, and lesions or rashes. So, to determine this is that kung normal siya, dapat free of lesion siya. And then also, it appears rugated and then dark, medyo darkly pigmented lang siya gabay. And then also, after sa inspecting the scrotal skin, we are now going to palpate the testicles and also the nearby structure on it. So, nga rin makita ang size, gihapon, ang shape, ang consistency, if there are lesions, swelling, epididymis, spermatic cord, some vas deferens, rinana, gihapon. And then also, for this palpation, we are going to perform auscultation and transillumination if abnormal mass of swelling is noted. So, manto siya. So, by this is that we are going to palpate the testicles and then the epididymis of our patient. After that, palpate the spermatic cord and the vas deferens of our patient. Next is to transilluminating the scrotum of our patient. And then, that is time that we are going to determine down the normal finding. There are two descendant testes that are palpated on it. And then, no swelling, tenderness has been, and then, or masses has been noted, and then along the testicles. And then also, epididymis or spermatic cord is either side. Alright, so by next is that, under gihapon siya sa male genitalia area, is that we are going now to inspect and palpate the hernias, which is we're going to note the inguinal area, and the femoral areas or for bulges or masses of our patient, the male patient probably. So, by this is that we are going to palpate for the inguinal hernia of our patient. And then also, palpate the femoral hernia. Kay sa hernia man ni siya, inspect na yung palpating. So, makita dire sa hernia, kung normal man siya, there are no bulges or masses has been noted on the inguinal or the femoral cord, femoral canal. So, siya. And then next is we are going to palpate the lymph nodes. Kaya naman nandiyan ng mga lymph nodes. So, if palpable siya, we are going to note the size, the consistency, mobility, or tenderness of our male patient. And then, that is a time nga, ang normal finding niya is not palpable. Okay? And then also, palpation gihapon siya to note the size, the shape, the consistency, to identify any nodules or tenderness. Bali, ang prostate ni siya, kaya under man siya sa by assessing the male genitalia of our patient. So, kung normal gani ang palpation, there are two lobes nga palpable siya. Smooth, non-tender, and then also napud siya rubbery approach. And then also, if imo ikuha ng prostate niya, bali 2.5 cm long siya. Bali katason man na siya. And then median sulcus. And then palpable siya between the two lobes. So, mo na siya. So, maura to siya ang for assessing the male genitalia, which is gastate ko sa mga procedures nga happenings ko mag-assess ta. And then also mo to siya ang mga normal findings nga mga mahitabo. So, that's it for the assessment of genitalia, the male genitalia, and the prostate. So, thank you and God bless.